Hello friends, welcome back one more time on my YouTube channel Dr.Nilesh Advice. Today's topic is a little bit uncommon. This is not a very common topic. You might have read our thumbnail, that is a lactose intolerance. So this topic is more related with the lactose. What is lactose? Lactose is basically the sugar which is present in the milk, that is known as a lactose, and intolerance. So when the body is not able to tolerate the lactose sugar, that is known as lactose intolerance. So we have splitted the word lactose intolerance. What is lactose? Sugar present in the milk, intolerance, not able to digest or not able to go well with your body. So that is known as lactose intolerance. So this is one of the brief about what is the lactose intolerance, what we mean by the lactose intolerance. Now later on we will see that how the lactose intolerance develops, what are the symptoms of the lactose intolerance, when you need to visit the doctor for the lactose intolerance, and some of the brief about how it is getting treated. So we will, in a nutshell, I want to give you the brief about the lactose intolerance. Obviously, as you are knowing that these are the educational videos, these are not the videos for the treatment, recommendations, promotions, nothing like that. It is just for the education. So this kind of the education videos are useful because now there are a lot of informations available on the internet, and many times the common people don't know whether they are true or false, and they follow those recommendations by the influencer, and they'll end up in the trouble. On a day-to-day basis, many times I am encountering in my OPD, the parents are saying that my child looks like the lactose intolerance. When I will take the history in the detail, when I will examine the child, then I will tell them, no, this is not the lactose intolerance. But surprisingly, how they came to know about the lactose intolerance, same thing. Some of the social media influencer has talked about it, then they will start thinking over it, then they will start experiencing about it, then they will come to the OPD for the clarification that whether it is a lactose intolerance or not. So how this cycle is going on, so that's how the social media is. So we have to play a very important role to define that informations, whether those informations are correct or not, and whether we have to implement those informations or not. Many times we are seeing that there are a lot of false informations on the social media, and parents follow those information to their children, and the children end up in a trouble. They have to come to the hospital, they suffer a lot, and there will be a lot of issues. So now let's come to our topic, what is the lactose intolerance. So the word lactose, so lactose means the sugar, and most of the sugar names ends with these O's, like the fructose, maltose, sucrose, and lactose. So all those are the sugars. So the chemical name are for the sugars ends with the O's. So fructose, maltose, sucrose, lactose, all are the sugars. Now the lactose is a one type of the sugar which is present into the milk and the milk related products. It can be present in the milk, cheese, paneer, and whatever products we are producing from the milk, it is present. So the lactose, whenever we are consuming milk and the milk related products, we are consuming the lactose. Now after the consumption of the lactose, the body will take those lactose into the stomach, then in the small intestine, then the larger intestine. It will get digested and it will come out. Now the most of the lactose is getting absorbed into the small intestine. So from the stomach it will come to the small intestine, and over the borders of the inner border of the small intestine, there are certain enzymes known as the lactase enzymes. So this lactase enzyme will digest those lactose which came into the small intestine, then it will pass it to the larger intestine. And the larger intestines, the main role is to collect all those digestive products, means whatever food we have ate, which is digested in the small intestine, that will come to the large intestine and it stays there. And then once the adequate amount is get formed, then we will get the nature's call to pass it out. So once you have ingested the lactose, once it will be start getting digested by this lactase enzyme, it will convert into the smaller part of the sugar, and then it will get absorbed into the intestine. Now what happened into the lactose intolerance is that whatever lactose we have consumed, the lactase enzyme is either insufficient or it has reduced because of some illnesses, so that this lactose is not getting digested properly into the small intestine. So now what will happen, that lactose will go to the larger intestine, and in the larger intestine it will start forming the gases which will come into the body, into the small intestine, and we will start experiencing the symptoms related to that lactose which is not getting absorbed or which is not digested. Correct word is digested, which lactose is not getting digested. So actual lactose intolerance has the symptoms like the belching, like we produce the gas and we will move it out from the mouth, that is known as a belching. So belching is one of the common symptoms. The abdominal pain, like intermittently abdominal pain, bloating of the abdomen, or the fullness or the heaviness of the abdomen, and sometimes the diarrhea also. So many times you also might have experienced that when you take more amount of the milk related products, you will start feel heaviness into your abdomen, and then you will produce more gas from the mouth, that is belching. Typically this kind of the symptoms develop after 3-4 hours of the consuming milk and milk related products. So the same thing happened with the children who are the lactose intolerant. So the lactose intolerant children will develop the bloating of the abdomen, discomfort of the abdomen, abdominal pain, frequent hiccough and the belching and the low stools. And if the situation persists for a longer time, then what will happen, they will have a more diarrheas and they will start losing the weight. So overall, on an average, when the child is experiencing the symptoms like this, like the bloating, belching, after 3-4 hours of the consumption of the milk or the milk related products, then it is suspected as a lactose intolerant. That doesn't mean that child is lactose intolerant always. So true lactose intolerance means the congenital lactose intolerance, which is there since birth, is very unlikely, or it is very rare diseases. But commonly it is happen after the sum of illnesses like the diarrhea, or when the children has more vomiting and the loose stool, viral infections. At that time typically develop this kind of the symptoms known as a lactose intolerance, or the not able to handle the lactose well. So this kind of the symptoms develop at that time, mostly in the viral infections like the viral diarrhea. What happened that the lactase enzymes is getting brushed out by the viruses which is present or which is consumed or which is infected the baby's smaller intestine, so that this lactase enzyme is getting washed out. So this lactose which went inside the body is not getting digested properly, and our large intestine will produce more gas from this lactose, and that's why we will develop this kind of the symptoms related to the intestinal symptoms, abdominal symptoms. Now whether this situation is serious or no, mostly this kind of the situations are not serious, because 85 to 90% of the time these are the very transient illnesses. As I discussed, mainly it is related with a certain type of the infection in the children like the vomiting and diarrhea. But there are many diseases where this kind of the enzyme, the lactase enzyme, is deficient or it is not there in the body. Then yes, then the situation is different, because it will require the lactase enzyme from the outside. like in the medication form, we have to give this lactase enzyme to the body so that they will able to digest the lactose. The weight loss is also one of the feature when it is lactose intolerant children, because as you know that we need the carbohydrates, sugar for the formation or for the energy of the body. So if we don't get enough digested sugar, then body cannot utilize it. Body cannot utilize, so body will start using the fat for the energy or fat for the calories, so that it will start causing the weight loss. After the fat is getting utilized, they will start utilizing the proteins of the body, so that child will have the growth faltering. The growth will start going down and down and down. So lactose malabsorption or lactose intolerance, the major features are the heaviness of the abdomen, vomiting, diarrhea, discomfort, belching. These are the commonest symptoms of the lactose intolerance. It is not very common in the children, but as this kind of the illnesses comes regularly, like the vomiting, diarrhea in the children develops quite regularly, so that children may develop transient lactose intolerance. Maybe for 2 weeks, 3 weeks they develop this kind of the lactose intolerance. Now the true lactose intolerant children, like the children who are the real lactose intolerant, meaning who has this deficiency in this lactase enzyme, they generally requires a lifelong treatment, because that will not get cleared within a few days. But the children who has developed this lactose intolerant in a shorter span related to the illness like the diarrhea and the vomiting, that will get treated very easily. For the 2 or 3 weeks, if you will not give the lactose containing products like the milk and milk product, you will not give, and maybe sometime it requires the supplementation with the lactose free formula. So instead of giving the cow's milk protein formula, you can give the lactose milk lactose free formula, so which is commonly known as LF formula. So some of the marketing formulas which is available, it is written like -LF. So routine formulas -LF it is written, that is known as lactose free formula. So lactose free formula is mainly used when the child has a little bit prolonged diarrhea, like maybe around, if it is more than 7 days the children has the diarrhea, then many times we advise to use the lactose free formula, because lactose stays inside the intestine, it will draw the more water in the intestine, so there will be the more diarrhea and the more pain and the disease is prolonged. So lactose free formula is advised when the child has little bit prolonged diarrhea, but that also under the examination by the doctor. Now when you have this kind of the symptoms, you will go to the doctor. So doctor will check about 2 things. So mainly he will assess the weight, height of the child and how he is growing, and since when the problem is there, all those things will be get discussed by the doctor. He might advise a certain blood investigations which help to find out whether there is a lactase deficiency or the lactose intolerance is there or not. Mainly they do the examination like the stool examination. In the stool we want to see that there is a reducing substance. Reducing substance are basically mainly the sugars. So whether it is coming into the stool or not, and how is the stool like, whether it is acidic or the alkaline. So basically you know that once the stool is getting fermented, it will form the acid. So if the stool is acidic and the stool contains certain reducing substance into the examination, then overall we will come to the conclusion that the child might have the lactose intolerance, and where we advise to avoid the lactose for a shorter time and then re-evaluate that whether child become lactose tolerant or intolerant. So what we have discussed today is that what is lactose intolerance. Lactose is the sugar present into the milk, and the person who develop the symptoms related to the indigestion, that is known as lactose intolerance. If there is a weight loss, the symptoms are more, abdominal pain is more, diarrhea is more, you need to go to the doctor to get it checked. Examination wise, the doctor will check the weight, height, growth of the child, and he will advise a certain blood investigation and the stool examination. In the stool examination, we want to see the reducing substances, pH, whether it is there or not. Then we will come to the conclusion that it is like the lactose intolerance, and lactose intolerance requires the avoidance of the lactose containing food for a transient time. True lactose intolerance is very rare or very less, so never thought that it will be the lifelong disorders. So friends, I have tried to inform you about the lactose intolerance, how to go, where to go, when to go, all those things. If you like this video, you can share with your family, friends, and let them get educated about what is lactose intolerance. This kind of the informative videos we are going to keep on preparing, so that increasing the awareness about the disease and don't get diverted with the social media influencers. Thank you very much.